Hi everyone, good evening or afternoon, whatever time you're watching. We're back with Beauty and the Business. I'm Camelia, and today we are with Dr. Goh from
Hi.
Beleco Clinic.
Yes.
I pronounced it right?
Yes,
Okay,
that's correct.
Beleco Clinic. Okay, so before we get to know a bit more about Beleco Clinic, let's get to know Dr. Goh a bit.
Yes, sure.
Okay, so Dr. Goh, can you share a bit about yourself? Maybe your journey before you became the founder of Beleco Clinic.
All right, sure. Okay, my name is Dr. Goh Ming Chun. I'm originally from Penang.
Okay,
So I graduated from University Putra Malaysia, UPM.
we're from the same university.
Oh, is it?
Yeah, okay, later,
Right,
later,
so,
later.
yes.
All right.
So, okay, also after I graduated from UPM, so I served the government for 4 years in Hospital Sungai Petani
Okay.
and also Hospital Pulau Pinang. And at that time, I was trained under a renowned plastic surgeon in Penang.
Okay.
And then that's where I start to have this interest in aesthetic. So after I finished the compulsory service, so I resigned from the government. Then I start to go into the world of aesthetic.
Okay, okay.
Yeah, that's how I begin my journey in this aesthetic. So for now, it's almost 9 years I'm in aesthetic. Yeah, and I started Beleco Clinic during MCO, so probably
Okay.
like around 4 years ago.
Okay.
Yeah.
I see. So, just curious, right? Because you said your interest came about aesthetics when you were under a plastic surgeon, right?
Yes.
So, originally, did you want to be a doctor because you want to be a doctor, or you like aesthetic already?
Okay, I think I become a doctor because of course the academic wise
Okay.
allowed me to study medicine, and I was offered to study medicine in local university. At first, when we look. During younger time when we look at doctor, it's like, oh, this doctor profession, everyone want to be doctor.
Yes, yes.
So at that time, I'm almost the same. Like, so everyone want to be the doctor, and then I don't have any anything that I'm like really want to do. When choosing the course, so I was like, okay, like medicine offers, study medicine, then after that, study, then pass, and then become a doctor. Yeah, that's how it
How
goes.
you started.
Yeah, how I started.
Okay. So, what made you interested in aesthetic? Like, what was the experiences you've got under that
Okay.
plastic surgeon that made you
Okay.
like, I like this?
Okay, so first of all, I see plastic surgery like when I was in Penang, we do a lot of this we call reconstructive plastic surgery.
Okay.
So we do a lot of this cleft palate for babies and all these trauma cases. So I think that's inspired me to change someone, to make them more confident, to help them in a certain way. But then in Malaysia, to be a plastic surgeon, it's a very long journey. Takes very long
Process, and then like maybe more exams or something.
long process, which is not really something that I prefer. So I choose, why not? I go into aesthetic.
Okay.
I'm helping people give them back their confidence, help them to improve their skin condition, help them to slow down aging, and then I think that's also in a certain way helping people. Right?
Yep, of course. I see. Okay. So, how did Beleco Clinic came about? Like, how did it started?
Okay, it started like I told you before. It started during MCO.
Okay.
So before MCO, I was still working under other company, right? Also in aesthetic field. So during MCO, a lot of business they cannot operate. So even though clinic, it's a aesthetic clinic, many of aesthetic clinic was affected
Yes,
at that time. So I was offered this opportunity to take over a clinic.
Oh, okay.
First one in Puchong.
Okay.
At that time, at a very good price. So yeah, I said, why not? I mean, it's a good offer, and opportunities is there. And then and I have like at that time it's almost like 6 years in aesthetic business.
Okay.
So yeah, I just took over the clinic and rebranded it into Beleco Clinic now. So at the moment, up to date, I have 2 branches. Hopefully more to come.
Hopefully.
Okay. Hopefully more to come. Yeah, and then I'm starting from there.
I see. Okay. So, but Beleco Clinic is the name of your clinic, right? It's not
Yes,
the one
correct.
that you took over, right?
No.
So why Beleco?
Okay, this also like when we creating a name, we want to think
Yeah.
of a name of clinic. Just like
Yes.
when we're having a baby. So what name should we choose? So as
Yes.
usual, first thing we go Google.
Of
Name
course.
for clinic.
Okay.
Or name, I put name, I remember name for clinic, or
Mm-mm.
name for baby boy and name for baby girl. So I choose. And then at that time I choose a few name. But
Okay.
then when I like when I ask people,
Mm-hmm.
because I want to trademark my brand,
Okay. Okay.
so I cannot get a common name. Like I cannot put like beautiful clinic
Yep. Yep.
because that's a common word and I cannot register
Yes.
that. So I searched, come up. Then I saw this Beleco Clinic. So
Okay.
Beleco Clinic, it comes from a Latin word.
Okay.
It's called beautiful.
Oh.
Yeah, it's a state of beautiful.
A
So
state of beautiful.
state of beautiful. And then I
Oh.
checked with the trademark company whether
Okay.
I can register. They
Okay.
said, okay, you are good to register. So that's the name of clinic.
Oh, so you search. So this is Beleco is actually Latin.
Yeah, it's a Latin. Yeah,
The state of
beauty.
beauty. Okay.
Yeah, so it's sort of like match and with my philosophies like beauty. I focus more on natural beauty, enhanced beauty.
Oh yeah, I wanted to get there. So like, what is the vision and mission of Beleco Clinic?
So my main mission and vision is I
Mhm.
want to to have more people to like got these opportunities to how to say to get themselves into aesthetics because a lot of people still have these misconceptions that
Yeah.
aesthetic you have to be if you do aesthetic you will look not natural or you will look very fake some kind of thing. But aesthetic is not about changing you, but it enhance your current enhance the
Look.
current look, make you more confident. So like for example, if you have acne skin, teenagers they have a lot of acne.
Yep.
So a lot of those days, a lot of parents don't know what to do. Just leave it. That thought it's a normal process. So
Yes.
the kids end up become an acne scar, which sometimes, like most of the time, I would say, affect their confidence when they're looking for a job, they're looking
Yes.
for their partner. So yeah, that's how what I want to achieve, like having more people to get a good quality and then at an affordable price treatment.
Okay.
Yeah.
So you want to make it affordable for people to achieve
Yeah.
this look
Yes,
and whatever. I
correct.
see. Okay. So with that vision and mission that you share for Beleco Clinic, was there like any instances for what you do for your clients, right? For your patients. So the philosophy is like subtle enhancement, right?
Yes.
Was there any stories that you can share that it showed a significant change in that patient's life?
Yeah. So actually there's a lot.
Okay.
One thing that I like one customer that I remember is like so when she first came, she come with wearing t-shirt, wearing pants, wearing specs, no confidence.
Oh,
But throughout the journey, I can see her. Okay, the specs. She started to wear contact lens.
Okay,
That's the first change.
all right.
And then the shirt started getting. Oh, there's a nice shirt. And then after that, starting wearing like more fashionable.
Outfits like
Yeah, so
that.
she looks more confident. I think that's how I feel like my mission is accomplished by looking at my customer, and then they are getting their confidence, and slowly they become my friend. Like they bring their friend to sort of like enhance their
They
boost their
boost their confidence,
yeah, boost,
beauty,
enhance
and
their beauty, boost their confidence. Yeah, I think that's what I feel. That's how I help my customers.
And that's why you can see from your clients as well.
Yes,
Like as they go along the
as
process.
they go along, they become like of course they come in, they are the best version of themselves, but we make them even better than what they used to be before.
Understand? Okay, thank you, Dr. Goh. So, for aesthetic, right? So it's under aesthetic medicine, right?
Yes, correct.
So is aesthetic medicine, from what I understand, is there like different kinds of treatments?
Okay.
Is there like I've heard like non-invasive, subtly invasive. So can you elaborate more on those kind of things?
Okay. Aesthetic clinic usually I think first of all we have to differentiate aesthetic clinic and beauty salon.
Okay.
Okay. So aesthetic clinic our nature of the business itself, we are clinic. So we are registered clinic under Ministry of Health.
Yes.
So we can see like normal GP patients, like normal cough and cold, diarrhea and all that case. But we provide extra service on aesthetic, which involve invasive and non-invasive treatment.
Okay.
Okay. Invasive, usually what we do in clinic is we call minimally invasive,
Okay.
which involving like needle injection, thread lifting. Non-invasive will be all the machine. Of course, we do provide service like facial as well.
Okay.
Facial and then slimming, hair loss treatment, and all this is considered into aesthetic
Aesthetic as well.
clinic. Yeah.
So is injectable based solutions under non-invasive or like minimal invasive?
Minimal invasive.
Minimal.
Anything that is involving breaking the skin layer, like we breaking the skin, is considered like minimally invasive.
I see.
Yeah.
Okay. So at Beleco, right? Beleco Clinic, do you have like a specific age group that you would like to help in the aesthetic sense?
Okay. So now my age is, I'm almost like 36, near to 40. So my
I don't believe that by your look, but of course as a doctor and I was counting year two, I'm like, that makes sense. Okay.
So like I noticed my own concern is I started to notice like my laughing line getting longer. I start to, age starts to kick
Catch
in.
up to you,
catch
yeah.
up. Then we start to see the sign. So my focus is mainly I focus on my customer age group will be like 35 to 40 and above.
Okay.
Where they started to have this sign of aging. Example, the nasolabial fold, the what we call laughing line. Okay, the corner of the mouth, the line.
Yep.
The sagging, the jawline.
Yep. And then the crow feet
The
here,
crow
right?
feet. Yes. The droopy eyelid. Eye bag. So this is usually what my main focus. So I target a lot more on anti-aging, on like sign of aging.
Sign of aging, yep.
Yes. So my customer usually is all people like starting age from 30 and 35 and above.
Okay.
My oldest patient will be 85.
Ooh.
Yeah.
We'll get to that. Okay.
So that's very interesting customer 85. Yeah.
Okay. And he or she is still coming.
Yeah. Of course.
Okay. So you mentioned like because you focus on more on the 35 and above, right?
Yes.
So all this like laughing lines, droopy eyelids, baggy eyes. So what innovative technologies or treatments do you recommend here at Beleco for them to do?
Okay. Usually my treatment will focus, of course, is focused all on this anti-aging treatment. So I categorize my treatment into non-invasive and minimally invasive. Non-invasive, we have machines like art therapy for skin lifting, HIFU for skin lifting, Thermash for skin tightening. All these are like the big brand of machine in aesthetic world. And then for injectables, I have like Sculptra,
Okay.
I have like Elance. All this also we call a biostimulator to stimulate collagen. So it's also part of treatment that to fight or to slow down
aging.
Yeah, slow down the aging process.
Okay. So you do have various options for people
Yes,
to use.
depending on the customer. So
Okay.
like not all customers come, they are ready for injection. I would
Of
say
course.
most of the time, people when they first come into aesthetic clinic, they're looking for something non-invasive.
Yep.
They don't want any injection.
Because they're not used to
they're
it.
not used to
Yeah.
it. Yeah, they're not ready for it yet. They're looking for something that is no downtime. So they want to go back. They want to go out from clinic without people notice
Yes.
them do anything.
Yep.
I think that's the main. And then also, they want to, in KL, we always got this gathering, almost like most people, they got gathering after work, like work meeting, so they cannot have any downtime.
Yep.
So I would say majority of customers, when they first came to my clinic, they will go for non-invasive machine,
Okay.
like Thermash and art therapy. Then from there, after they have confidence, we build trust, and then they confident, they see a result, then they slowly move to slightly more invasive,
Minimally invasive.
like injection of either biostimulator or like Botox, all these things. So slowly they will
venture more deeper into it.
Yes, correct.
I see. Okay. So since you have how many years of experience again?
9 years now.
9 years,
Yeah.
right? 9 years. So I'm pretty sure you've seen various type of people, various
Yes.
type of patients and
Correct.
whatever, right? So for the age group that you focuses on, like 35 and above,
Mhm.
have you seen any like biggest misconception of this age group about aesthetics treatment?
Okay. Yes, I think not. I think in Malaysia, a big misconception is that if I do aesthetic, I will look fake. I will look like someone, right? I will look unnatural, and then these products will cause harm to my body, which is not true.
Okay.
I think in Malaysia, I will consider Malaysia aesthetics still in the very early stage,
Oh, okay.
comparing to our neighbor country like like Bangkok, like
Oh.
Singapore, like Taiwan. I think in those countries, aesthetic is become like routine, daily routine, just like
Oh.
skincare, just like
Yeah,
part
yeah.
of skincare, just like when we go do our hair, we
Yeah,
go
yeah,
do
yeah.
facial. But in Malaysia, notice that most of people still afraid of doing aesthetic. Yeah, they still thought, but it's not true.
It's not true. So like, why do you think people are scared? What are they scared of actually?
I think they scared of mainly it's because social media. I'll say
Okay.
like a lot of not good cases or not good result is being portrayed on social media. Like as usual. But anything that is good, usually people won't talk about it that
People won't
much.
remember
Yeah,
about
people will
it.
remember, right?
Yes.
But everything that is gone bad or anything that is not nice, people will
Make it viral.
make it viral,
Yeah.
everything viral, everyone know about it. Then I think the misconception comes from there. But in fact, in reality, a lot of people they get very good result from aesthetic without changing how they look. They still look themselves, but a better version, I would say.
It's just enhanced.
Just enhance, yes,
I
correct.
see. Okay, okay. So with all this new technology, injectables, non-invasive, minimal invasive, right? So I'm pretty sure, Dr. Goh, you have heard, or maybe even now, you have like stem cells or exosomes, right,
Yeah.
in your treatments, right? So what potential do you see for these two things in the non-invasive anti-aging solution?
Okay, stem cell and exosome is something that it has been in the market for quite some time.
Oh, okay.
But it has gained much popularity since MCO, I would say.
Okay.
People start to more conscious about how to improve their health condition, especially those who have been uh, had COVID before, so they try to find way to improve their
Their
health
health.
condition. So stem cell and exosome recent years become very popular, but it's still a very new treatment. There is no like there's no like really like a guideline or protocol on stem cell and exosome. But there are many proven cases, especially in overseas. If
Okay.
you search online, there's like all those athletes, all those celebrities are doing stem cell and exosome for their health mainly. And then, yeah, it's still something very new, but I can see there's a very big potential in stem cell and exosome because I can see from my own customer, their health improved, their look improved, and their energy level is improved. I think that's most important. Yeah,
So it's not just beauty aesthetic,
not
it's
just
also
beauty.
like overall health, is
It's
it?
just overall health. It improves their overall health in general. So yeah, that's I think moving forward, stem cell and exosome will be even more popular, and it will be more affordable to majority of people
Nowadays, because
Yeah.
it's more in demand and
More in
everything, right?
demand, yes,
I
correct.
see. Okay, okay. So you mentioned that exosome and like stem cells like since MCO, right? So right now we just entered 2025.
Yep.
So is there any trends that you see in the non-invasive technology that you're excited about? Like, is there new technology that's coming out soon?
Yeah, there in aesthetic industry, there's always new machine coming out.
Okay.
Like, I would say like every quarter or every month there are new machine coming out
really?
everywhere.
Okay.
In Korea, whether in Korea or in US or in Europe, there's new machine. But whether or not the machine works well it needs times to prove. So usually my
Understand?
style is I will observe first. So I will observe the machine, and then if it works, the machine will last. But if it doesn't work, the machine will be eliminated from the market. You won't heard about the machine anymore after
Yep.
like 1 year. Then the machine required. Like I choose the machine in my clinic. I choose machine that has a long history,
Proven results.
proven result.
I
Yes.
see.
For example, Thermash, our therapy, it has been in the market for 20 years. It's the same company still selling the same machine, improve their technology. So I ask myself, why the same company can still selling the same machine for so many years and still doing so well after so many years, and people are still doing it. I mean, something must work.
It's working.
It works working, right? So people are looking at it.
Yes.
So there's something. Sometimes the machine come out like 1 year. Then after 1 year, where's the machine or where is the treatment? No more. You can't find. You can't even find the distributor or anything. You won't hurt, or people not even looking for it anymore. Meaning, it's not that.
It doesn't work
It
anymore.
doesn't work.
It cannot prove that itself anymore. I see. Okay. So I'm gonna go back a bit about the age. So you say that Beleco Clinic, you focus on like 35 and above, but of course you do accept people who are younger.
Yes, of course.
As well, right?
Yes, of course.
So it doesn't matter age group. Actually, just can come.
Yeah, you just can come no matter, as long as you are 18 and above. If you are younger than 18, you have to have your parents, your guardian or your parents' consent. Better to come together with parents. Because for younger age group, I treat like acne cases, especially teenagers. They start to, they have a lot of acne breakout. So it's always better to treat during the acne breakout rather than waiting until it becomes a scar. Then you only want to treat the scar. That will be even like longer journey and more time needed, more treatment needed.
So prevention is better than cure lah.
Yes,
before it gets worse.
Before it gets worse.
I see. Correct. Okay, so you can do younger, definitely. Okay.
Yes, correct.
So you mentioned also you had a patient that is 85.
Yes.
So without disclosing anything about the patient, of course, what treatment is this patient doing?
Okay.
Like, what is it for? If you don't mind sharing.
Okay, 85. It's very interesting. So I'm surprised as well, 85, but I think we have to get used to, because now with all these supplements like stem cell and exosome, people actually 85. Those days we think 85 is very old, but now I think we have to change our mindset of thinking. 85 might be still very young, right? People are living, people lifespan are getting longer and longer.
Yes, yes.
So 85, you still can, I think, function quite well, function normal. So I think every human being loves beauty.
Yes.
They don't want to see their face sagging.
They don't want to look like, oh, who's that?
You don't want to look like 85. When they're 85, they want to look like I'm 60 plus.
Yes.
So they still want to social with their friends. So for this customer came in for, as usual, aging.
Yes, of course.
Aging for aging issue like sunken. It's like, when you age, you lost some fat, you lost some muscle, you lost some bone. So we enhance on that. So we replace the collagen.
Okay.
We use machine to stimulate collagen. So we don't change her.
Okay.
She's still 85, but we make her look fresher. Look younger than her age.
Okay.
She still grow old. But she grow old gracefully. Correct.
She looks very elegant.
She looks very elegant.
Like very elegant, very demure.
Exactly. So if you imagine if you have like a 85 years old lady standing in a row, so you'll see, oh, that's my patient over there, that's my customer over there who looks different from
the others.
85.
Okay. So I'm assuming that the treatments are working very well for her to keep coming and all that.
Yeah, definitely, definitely.
So like if there are older patients, maybe not 85, maybe in their 70s, maybe like 65 and above, right? So if they do want to do treatment, they can do it at Beleco, right?
Yes,
because you also have proven results.
Yes, exactly.
Okay, and do you like personalize the treatment according to their needs?
Yes, of course. All our treatment is personalized based on the customer needs, based on what they are looking for, and then based on what kind of result they want to achieve.
Okay.
Yeah, I think I think all the treatment is personalized. Each customer is different.
Okay, okay. So, because you want to make it work for them.
Yes, correct.
I see. Okay. And you do have customers, like, is it only females or do you also have male customers?
I do have males, but majority will be females. Yeah,
Okay.
I would say like maybe 20% is male, 80% is female.
Okay. But males, if they want to do it, they don't have to be shy, right? They can
Yes,
just come.
of course, of
Yeah.
course.
Because beauty is not just for girls.
Yes,
It can be for men. For
Yes,
men.
definitely.
Yes. Okay. Okay. Great. So, as you mentioned, Dr. Goh, that Beleco, you took over a different clinic, right?
Yep.
So let's go a bit about the Beleco Clinic itself. So you took over in which year again?
I think in 2020 when
So COVID happened.
Yeah, when
Okay.
COVID happened that
So
time.
this is like your 5th year
Yes.
in the market
Yes.
as a clinic, right?
Yes.
So technically 2030 is not that far away. Okay, 2030 is not that far away. So
Yeah.
what's your vision for Beleco Clinic in the next 5 years?
Okay. At the moment, I focus on. I love sharing.
Okay.
I love sharing with junior doctors, sharing my experience. So they don't have to go through the same, things that I
You had to go through.
that I had to go through. So end of last year, I think I have one what we call Beleco Excellent Training Center.
Oh.
So we have a lecture, not like a room,
A room,
where
okay.
we can cater like 40 to 50 doctors
Okay.
at maximum capacity. So where we do training for doctors. So local brand, I mean not local brand, all those aesthetic brand that they want to do training, so they can use our space to provide training for junior doctors. So that's my aim. It will be like we can have more. I can train. Not I can train. I can share with more junior doctors about the correct technique and then safe technique for doing practicing aesthetic. Yeah. Yeah,
That's you see in 5 years.
Yes.
So that
And
is also how you see you're contributing back to the aesthetic industry in
yes,
Malaysia.
correct.
I see. Okay. Because I think, like as you mentioned, some people they have fear of doing aesthetic treatments because wrong treatments, they got like bad results. So that might actually come from one, it might not be certified doctors that they
Yes,
went to.
correct,
Yeah.
correct.
But also maybe the technique done is wrong or whatever,
Yes,
right?
correct,
So knowledge is important.
Yes, knowledge is important. I think at the moment in Malaysia we don't really have like not much center offering a training place or training ground for doctors to do their hands-on
For aesthetics specifically.
specifically.
Oh,
So
okay.
they are like a small space, but they don't have like a big,
Like a proper
big
big
room.
space.
Yeah, big space
I
for
see.
aesthetic training. So, Beleco Clinic, I'm not only like want to help my customer, but like you said, we contribute back to the aesthetic industry and the aesthetic world business that we train junior doctors. So make sure our standard of aesthetic is getting better in Malaysia.
Malaysia. Okay, okay. So what do you have to say, Dr. Goh, about people who are still like, I understand, like especially like I do have like older relatives. I have a mother who has turned 50 already.
Yep.
So like what advice do you want to give to the 35 and above, right? Maybe even like 50 and above, who is they want to age gracefully, but they're scared. Any advice or message you want to share to them?
Okay, first of all, I think for we call newbie to aesthetic, right?
Okay.
So I think first of all you can Google. Now
Google.
it's very easy. Google everything, anything, everything is on Google.
Yes.
You can do your own study, your own research first, and then choose one clinic. Don't be afraid to go for consultation. I think most of the time, even though there are consultation charge, there won't be a lot of consultation charge. Then they can consult with doctor first, and then decide whether which treatment is suitable for yourself.
Yep.
They can consult a few doctors actually, because there's a lot of aesthetic clinic now in
Yes.
the market. Everywhere is aesthetic clinic.
Yes.
So they don't have to make the decision immediately. They can consult with one doctor, and then consult maybe another 2 or 3 more.
Have a comparison,
Can have a
right?
comparison. Yeah, but you consult and ask for the treatment, but then price. But if you are comparing the price, then it's very dangerous, because because if you are looking for a cheaper price, then you might fall into what we call aesthetic scam, or what, where you doesn't get the good quality of aesthetic treatment, and then you will have a wrong or misconception about aesthetic treatment altogether again. So just don't be afraid, don't be shy. You can consult, you can do WhatsApp consult, you can call and ask, or you can just even walk in the clinic.
Just walk in and just give it a go, right?
Just give it a go, and yeah, why not?
Okay. So like, how about if for the younger generation, do you think aesthetic treatment is suitable for, I wouldn't go so young, but maybe like when they start becoming teenagers, maybe like 13 and above. So maybe like people say like, oh, you're so young, you shouldn't do it. But do you think it's okay for teenagers to start trying aesthetic treatments as well?
Okay, to me personally, I don't. If you are still under 18, right, you should maybe just focus on the skin health. Like you have like very bad acne, you do some treatment to control the acne, control the breakout, but don't go for any like aesthetic treatment per se yet. Yeah, because you are still
quite young.
Still quite young, and your look still will change somehow along the way. So wait until you're 18, or wait until you have your your financial is stable. Then only you start to
do your own treatments and
do your
stuff.
own treatment.
Okay, got it. So preferably not yet, unless like you have your consent of your guardian, and you actually really need it for whatever purposes, right?
Actually, it's that what you say is correct. Actually, you need it, then only you do it. Like skin health, skin conditions, like allergy, and all these things.
Like that. If you have like maybe like very bad eczema or something, some people have very bad skin condition. So that's a different thing.
That's different thing, but not for like wrinkles, not for like double eyelid, not for like taller nose. I think that's too young.
Too young to think about that.
Think about that later after you
finish your studies first.
Yes, correct.
Okay. Got it. So for Beleco Clinic, right? So Dr. Goh, you've shared your expectation for the next 5 years. So you already have 2 branches. So we are in your PJ branch.
Yes, correct.
But you started off at the Puchong one, right?
Yes, correct.
Okay. So is there any more branches we're expecting soon?
Yes, hopefully. I'm looking at it, but I said aesthetic clinic is different from other business. It's like we are very much skills dependent. So it depends on a doctor's skill. So I have to make sure like our quality is on par for all the branches.
I see.
Yeah.
So you want to take care of that.
Yes. So I don't want that we can, opening a new clinic is not difficult, but to make sure that all the clinic have the same quality service, I think that's my main concern, and what I want to make sure that if I open more, I'll make sure all my clinic provide the same service quality. All my doctors is the same standard.
Okay.
Yeah.
You want for them to follow a SOP, standard of procedure
Standard
first.
procedure, and then I think SOP, and then also doctor skills. I think that's the most important.
I see. So that's why you also like want to focus on the junior doctors getting the right information.
Yes, correct,
I see.
correct,
Okay. So it feedbacks to the loop of that getting better doctors.
Yes.
I see. Okay. So for now, with this podcast, is there any advice or tips you want to share to like younger doctors or potential doctors who want to venture in aesthetic?
I think go ahead. Don't be afraid.
Don't be afraid.
Don't be afraid. If you think that aesthetic is what something that you like to do,
Mm-hmm.
you love beauty,
Mm-hmm.
yeah, just go ahead, give it a try. Why not?
Mm-mm.
You might be talented in aesthetic.
Mm-mm. You never know,
You
right? If
never
you don't
know. Yeah,
try,
just try it out.
just give it a go.
Yeah,
Why
just
not,
give it a
right?
go. Yeah, why
Okay,
not?
okay. So, Dr. Go,
Yeah.
before
Mm-hmm.
we end our podcast,
All right.
so do you have anything to share
Mm-hmm.
to the people,
Mm-hmm.
to the viewers,
Mm-hmm.
about Beleco Clinic? Do you have any upcoming promos? Because CNY
Okay.
is coming
Yeah,
soon.
yeah. Okay. So at the moment we have of course CNY. We have CNY promo.
Okay.
So our earlier mentioned, I focus on two main machine, our therapy and thermage.
Yes.
So you can get like you don't have to worry about there's a lot of fake machine out there, so you don't have to worry about that.
Mm-hmm.
So we have the best team
Mm-hmm.
providing service on this anti-aging. So you drop by and give us a call, and you can just walk in to make appointment and consultation. And we don't charge for consultation fees.
Oh,
anyway.
okay. For guys to know, they don't charge.
Yeah,
Okay.
so
So if they want to reach out, so how can they reach out? Like call? Can they DM you on IG or how?
yeah, we have IG Beleco Clinic.
Okay.
Same for Facebook, also Beleco Clinic.
Okay.
And then you can Google Beleco Clinic. Our phone, you can WhatsApp us. You can WhatsApp your and ask us any questions or any if you have any
Concerns or
concern.
whatever.
Yeah, in WhatsApp, there will my team will reply you from there.
Okay. So they can go to either or branch, right?
Yeah, depending which branch more convenient to you.
Okay. Okay. So thank you so much, Dr. Gu, for your time.
Welcome.
Okay. Thank you for sharing about yourself,
Thanks.
about Beleco Clinic, and about aesthetic medicine.
Sure.
Okay. So I hope all goes well for Beleco Clinic.
Thank you.
And then may everyone be able to age gracefully.
Thank you so much.
Alright, so thank you everyone. That is all from Beauty and the Business for today. Bye!
Bye.